Hi everyone, and welcome to Moderni Spine's presentation on migraines and headaches. I'm Cynthia, PA and owner of Moderni Spine Clinic here in Minnetonka, Minnesota. So we actually did this as a presentation last night in person and it went great. We had a good discussion, good questions, and it's nice to be surrounded by fellow migraine and headache sufferers. Even though I wish, we all didn't have to deal with headaches and migraines. But I know there were some of you that weren't able to make it and some that had reached out about a recorded version. So we're going to go ahead and go through the presentation that we did last night. And if you have any questions, feel free to reach out to me. But I hope that this gives you some education and some tools to maybe take the next step in treating your migraines and headaches. Just a quick little bit about me and the clinic. So I'm a physician assistant, which now a physician associate name change has taken over, but I have a Bachelor of Science in Biomedical Science with a chemistry minor and a master's in physician assistant studies from Bethel here in Minnesota, which is 3 academic years of program straight through. I've been practicing a little over 6 years, and I've always practiced within pain medicine and non-operative orthopedic spine. So mainly within the teams that are not doing spinal surgeries, we are more of the diagnostic and treat spine side of things. So I opened Moderni in July of this year. I really just wanted to give pain care a different name. I wanted it to be fresh and inspirational and make people feel like they wanted to come to their appointments, that they felt empowered to do something about their pain, and that they were always in a welcoming environment. So here's what we're going to talk about. We're going to go over what types of headaches there are, what causes headaches, how they're diagnosed, and what treatment options there are. Headaches can be split into 2 different categories, a primary headache and a secondary headache. Your primary headaches are headaches that are not caused by some type of underlying medical condition. So really we think of a headache in a primary headache being the disease itself. A secondary headache, that's where we would think of the headache being a symptom of another disease. So it's caused by an underlying disease, meningitis, so an infection, tumor, high blood pressure. So essentially in the secondary headache scenario, if we were to treat the disease, the headache should go away. So what we're talking about tonight mostly is primary headaches, and this is going to be where migraines, tension headaches all fall under that category. Headaches can really be anywhere on the head, and knowing where your headaches usually occur give your provider a lot of information in terms of what type of headache you might have. So keeping a headache diary and keeping a good eye on where your headaches are, especially if they recur in the same place. Tension headaches tend to be that tight band around the head, almost like a vice feeling. Temporal headaches, so that's going to be in the temple region or in the temporalis muscle, which is along kind of above the ears there. Commonly, I'll see this with headaches that are stemming from a lot of TMJ or jaw disorders. Migraines are usually going to be what we call unilateral or one-sided. That being said, I have even experienced migraines myself where it ends up on both sides of the head. Cluster headaches, sometimes those will present similarly to migraines where they are on one side, but it's usually a very intense pain behind the eye. And you will also see physical changes a lot of the times with the cluster headaches. So eye redness, eye tearing, the nose on that side of the body will also run. A sinus headache in this picture, it shows kind of almost a butterfly pattern, so surrounding our nose, all the sinuses, and that's going to go in conjunction with some type of congestion or allergy symptoms as well. And then occipital neuralgia, that is in the base of the head, and that's where the occipital nerve starts or is sort of housed. And it can spread up to go behind the eyes. It can kind of shoot straight through toward the eye, but that's really where a majority of the headache is going to start. Now, tension headaches, I say that they're benign in a sense that structurally and underlying issue or the underlying pathology is benign. There's nothing big, bad, or ugly that is going on that has to be diagnosed or chased. But I say don't be fooled, because from the standpoint of how they can impact people's lives, they're not benign. They can definitely still be debilitating. When they continue to recur, it can almost be like a snowball effect. This can also lead to a type of headache called medication overuse headache. So if you're treating your tension headaches with over-the-counter medications on a daily basis, you can actually develop another type of headache on top of your tension headaches. So it might seem that your headaches are actually getting worse when now you've actually just developed a different type of headache. I have seen as well tension headaches evolve into what I'd consider tension migraines, where you get some migrainous symptoms, including nausea, vomiting, sensitivity to light. So tension headaches can definitely be a beast of their own. Causes of tension headache: stress, poor posture, non-ergonomic work conditions. So if you're slouching at work a lot, or if your computer monitor is too high or too low or too far off to the right and you're constantly turning your head to look, that would also be included in repetitive motions. Poor sleep, so not getting enough sleep and then also being stressed out. Computer and reading for prolonged periods of time, especially if you're squinting. If people have a prescription, glasses or contacts, I always like to remind people it's important to go to your optometrist once a year to have your prescription and your eyes checked. They can also see a lot into what other things might be going on in our body. Sometimes they have the first look at other diseases that might be going on in the body. If you find yourself squinting a lot and you've never been to the eye doctor, now might be time to go, because that can definitely cause tension headaches. These are some common muscles that are going to be triggered with tension headaches. So this man is holding his suboccipital muscles, so muscles that sit just below the base of the skull, a small group of 4 muscles. Then the trapezius and the levator scapulae, those are larger muscles that are going to kind of overlay those suboccipitals. The masseter is that main muscle in the jaw. Temporalis, again, by the temples. Frontalis and occipitalis, so in the front and the back of the head. And then you'll probably, notice all these points when people have tension headaches. These tend to be all the points that they're usually massaging. Occipital neuralgia. So this can be a type of tension headache. So some of those muscles I mentioned, especially the suboccipitals, are in close proximity or adjacent to the occipital nerve. So if there is a lot of tension on those muscles and a lot of tightness, you can actually entrap or irritate the the occipital nerve, and that can cause an occipital neuralgia. There can also be direct trauma to the neck or head, giving damage to that nerve. A pinched nerve in the neck as well, so in that cervical spine, can lead to occipital neuralgia pain. Then there's also types of neuralgia or neuritis, inflammation of the nerve, that is idiopathic, meaning there's not an underlying cause that we can necessarily diagnose. That nerve is just sort of acting out on its own. Cervicogenic headaches. So cervicogenic headaches are arising from the cervical spine. So whiplash injury, disc degeneration, disc herniation, or a pinched nerve. So I will circle here. You can see these small joints alongside the spine. These are called the facet joints, and they're paired, so they're on each side of the spine. These joints are very susceptible to injury, especially when it comes to whiplash injury. So these joints, whether they're injured or if there's arthritis, the joints higher up in the spine here create a pattern of pain that's similar to an occipital headache. So the pain can go up into the base of the head, and sometimes it can keep going up and radiate toward the eye or even toward the ear as well. Pinched nerves in the neck, that can also do a similar pattern too. So if anything is coming from a spine origin, it's considered a cervicogenic headache. Migraines. So migraines are complicated. There's a lot of discussion on where do migraines start? What is the true pathway of a migraine? There's a lot of look into genetics. So there's some hereditary component that we know about that causes migraines. So if you come from a family with migraines, you're more likely to be diagnosed with migraines as well. There's also thought, similar to other chronic pain pathways, that there's overexcitatory nerves, these nerves that normally wouldn't be firing or wouldn't be overexcited are, and it's leading to generate these chronic pain conditions, including migraines. And there's other neurotransmitters, or what we call cell signalers, that they've been looking into to see what their role is in migraines. One thing I like to say is if you've never been actually diagnosed with migraines, don't necessarily assume or diagnose yourself with migraines. It's always smart to go into a PA, nurse practitioner, or a physician and get a diagnosis of what your headaches are. Because there are some things which we'll go over a little bit later that we want to make sure you're not experiencing, because that might require even further workup. Migraines, again, the pain is usually going to be on one side, but it'll come with kind of a slew of other symptoms. So nausea, sometimes vomiting, and aura, which we'll go over on the next slide, a really deep throbbing pain, and sensitivity to light or sound. So migraines, you can have a migraine with aura and without an aura. Migraines with aura used to be called a classic migraine. What people get is some type of visual phenomenon that occurs before the onset of the migraine. So this can last up to an hour. Some people see colors, lights, flashes. Sometimes people can lose some part of their vision within that eye. Usually the aura that they experience is likely the same every time or close to the same. You can also get numbness and tingling on that side of the body. If you're experiencing an aura and you've had the same aura for many years and all of a sudden your aura changes, that's something to go into the doctor for as well. And then migraines without an aura, it's still a migraine. You just don't really get that initial warning like an aura. Timeline of a migraine attack. So a prodrome, so beginning before the actual headache, this can be up to days. So things that you might relate to just normal stressors in life, or thinking you're behind at work or home life has been stressful, might actually be related to the headache itself. So being irritable, depression, anxiety, changes in how you're sleeping, changes in how you're eating. So a lot of those things that sometimes we're just chalk up to, oh, I'm just like really extra stressed this time, and they might actually have to do with the headache. Then the aura will be about 60 minutes before the headache. It can last up to 60 minutes. Sometimes it can be only 5 minutes. And then the headache itself is the main event, and that can last even up to 3 days. So headaches or migraines are a multi-day event. A lot of people that don't suffer with migraines don't realize how many days are actually included in this cycle of a migraine. So after you have the headache event, that's when you're going to have the anxiety, the nausea, the vomiting, the throbbing pain, sensitive to light and sound. Then you'll move into what I call the headache hangover, or what they refer to here as the postdrome. So that can last up to 2 days. Honestly, I've had it last even more than that. You just kind of feel foggy. You just feel a little out of it almost. So fatigue. So those are very common symptoms of a postdrome after a migraine. Medication overuse headache. So this is actually pretty common. To be diagnosed with a medication overuse headache, you have to be misusing the medication for at least 3 months. Honestly, by the time I see people, it's been much longer than this that they've been on these medication regimens. So I've split the medications into 2 groups. Group 1 is going to be mainly your over-the-counter medications. So your NSAIDs, your non-steroidal anti-inflammatories. That's going to be ibuprofen, Advil, Aleve, naproxen. Then you're going to have acetaminophen, which is your Tylenol. Any combination of those with or without caffeine would be something like Excedrin. Those are also in group 1. So if you take these medications more than 15 days out of a month, your headache could potentially be from a medication overuse. Group 2 is going to be your prescription medications. So usually medications that are prescribed to get rid of migraines, like sumatriptan, so people know that as Imitrex, rizatriptan, Maxalt, ergotamines, opioids, so oxycodone, tramadol, butalbital. Those medications, if you use them greater than 10 days a month, that can also be a medication overuse. So just keep track again in your headache diary, or even in your phone, if that's where you have your headache diary, or just a notepad of when you take medications, what medications you take, so you can kind of look back and see how frequently you are taking something. Getting to the right diagnosis of headaches. So For me, it's two main things: a thorough clinical history. So I want to know how long you've had these headaches, when they started, what happened when they started. Were there different stressors in your life? Was there some type of trauma, some type of accident that started these headaches? Then we're going to look into what have you done for treatment? What other symptoms come along with your headaches? What your family history is like? And then a physical examination. So having a good neurological physical examination just to make sure that everything from a neurological and muscle standpoint is functioning okay, and to see if there's anything else that would point us in a different direction. Other helpful tools might include imaging, so an MRI of the brain, an MRI of the spine. That's going to again depend on where your headache history leads us and where your physical exam leads us. Blood tests, and sometimes we could do diagnostic injections. So that means doing an injection with some type of numbing medicine to block or numb the source that we think that pain is coming from. If it works and you get pain relief, we try to isolate your headache type using those. Being aware of red flags. So red flags are really things in a headache history that make us think some more urgent workup is needed, or at least some further workup other than a clinical history and a physical exam. So if there's a new onset of a migraine or a headache in someone greater than 50 years or older, definitely requires a little more workup. Usually with migraines, it's going to present in late childhood, early adolescence. If there is temple pain, so pain in the temple, especially one side that's very severe and very new. If your headache is associated with any type of fever, a stiff neck, significant vomiting. And then a thunderclap headache is what we would consider a sudden onset of the worst headache of your life. So thinking of how fast a thunderclap happens during a thunderstorm, that's how the headache comes on, and that's how severe it is. Any changes to a previously stable headache history is also something to look into. Any history of cancers and changes to the pattern or the headache type that you've previously experienced. So, so natural and supplemental treatments, I always let people know to start with this, even if you're thinking about going on to other pharmacological treatments or injections, procedures. Use some or all of these treatments in conjunction with that, as long as your body tolerates it. CoQ10, that's an antioxidant. So what that's going to do is help the cell function normally. What's happening is there's damage in these cells. They can't produce energy the way that they need to, and there's a buildup of what we call reactive oxygen species. So CoQ10 helps break that cycle, get the cell back to normal. Melatonin, that is the medication a lot of you have heard about taking at night. So it can help with the sleep-wake cycle. That can be helpful, especially even in tension headaches, to get you out of that sleep and stress fatigue cycle. It can also regulate neurotransmitters. So that's going to be the ability to regulate all those cell signaling molecules that are telling nerves when to fire. Magnesium is a mineral. It is vital for nerve function, helps with muscle function, and it helps reduce neuroinflammatory activation. So you can kind of think of magnesium as throwing little buckets of water on the fire when the nerves are fired up. It can be very helpful from a preventative standpoint, something to take, in a lower dose daily. But when those migraines or those headaches do come on, it's something that you can increase that dosage of for that acute phase. Sometimes we can dose it intravenously or intramuscularly for an acute migraine as well. And then vitamin D, especially if you grew up in Minnesota, live in Minnesota or the Midwest, we usually are low on our vitamin D. It can be helpful for magnesium absorption. And vitamin D deficiency has been linked to many different pain conditions, including migraines, but also other pain and neural conditions like fibromyalgia. And it can also help with tension headaches. So one thing you can do, especially during the winter, or with your primary care visit, is get your vitamin D level checked and see where actually you fall. Because if you're not deficient at all in vitamin D, you don't want to supplement as much as someone who is truly deficient. So that might help as well. Now, whether or not you buy everything over the counter or you decide to get some of these supplementations or minerals through your diet is completely up to you. Our bodies tend to metabolize things better when it's taken in a diet versus in a pill form. But one of the things you'll see in common with magnesium, CoQ10, and vitamin D is they all have fish in common. So if you don't have any religious or dietary restriction to fish, that's something to definitely put into your diet. Then you can look CoQ10 peanuts. So if no allergies, of course, but you can cook with peanut, doing like Thai chicken with peanut butter can be really delicious. And then you're getting kind of that peanuts with the CoQ10. Vitamin D, mushrooms are actually fairly high in vitamin D. There's a couple mixes out there with multiple different mushrooms in a powder form, and you can stir them into your coffee, you can stir them into your water. So those are options too to be able to get mushrooms. Pharmacological treatment for migraines, we're looking at two sections. We're looking at preventative and abortive treatment. Preventative treatment is something that you would take daily to prevent migraines. If you have 4 or more of those a month, it's recommended that you be on a preventative or kind of a maintenance therapy. These are some of the medications that are most commonly used. There's definitely medications that fall outside of this that are used as well. Anti-seizure medications, beta blockers, so those are medications that people are on with high blood pressure. So propranolol is one medication. CGRP antibodies, so this is a newer therapy. These are injections. You might have seen commercials for these, Amavig, Emgality. They can work really well for people. Tricyclic antidepressants is a class of very old antidepressants. It's actually more commonly used now for migraine and other neurological disorders than it is for depression. And then Botox injection for migraines is also considered a preventative therapy. Abortive therapy, so this is to stop an acute headache. So triptans, that's sumatriptan, rizatriptan. Your gepants, so these again are newer. They're the CGRP. CGRP is calcitonin gene-related peptide. So they essentially block the receptor for that. Qulipta, Ubrelvy, Nurtec. That should say Nurtec, sorry. And then Toradol is an anti-inflammatory. I always describe it as a beefed up ibuprofen. Zofran is an antiemetic, so nausea medication that can be helpful during a active migraine. Magnesium, again, we can give that via an IV. And then abortive procedures. So if you've taken medications and they're not helping, or if you don't want to take a medication, there are different procedures that we can do in the acute phase that can help with the migraines. Non-invasive options, so very similar to magnesium, CoQ10, melatonin, it's something that's definitely worth a try and something to supplement things that you already might be doing. There is a TENS unit called the Cephalate that goes on your forehead. It is FDA cleared for treatment of migraines, both prevention and acute treatment. It's relatively expensive. It is something that we have here in the clinic for acute headaches in the migraine oasis, something that can be used. Otherwise, using a TENS unit as well. If you have tension headaches, putting the TENS unit on some of those larger muscles of the upper back and the bottom of the neck can be helpful. Essential oils. So there's a lot of essential oils that have been proven to help with migraines. That being said, everyone's sensitivity is different. So if you know that smelling peppermint during your migraine will make you throw up more, don't pay attention to the peppermint on this list. But these are just some more so researched essential oils that can be helpful. Eucalyptus, that's going to be more for sinus related headaches because it will really kind of open up those nasal passageways and help relieve some of that pressure of a sinus headache. And then SEEDS. The SEEDS mnemonic is from American Migraine Foundation. It stands for sleep, exercise, eating, diary, and stress. So those are 5 of really the main things that you can do consistently to help manage your headache. So what can I do at my clinic at Moderni Spine? So medication management, we can manage all of those medications, whether it be the prevention medications or the abortive or the acute phase medications. There's nerve blocks that I'll go into here in just a little bit that can be very helpful for headaches. Those can be done again during the acute phase, or they can also be done not necessarily as a prevention, but if someone has kind of always a degree of underlying pain, we can do it as a treatment and hope that you don't get to kind of that acuity that sometimes these headaches can get to. Botox for migraines. Laser therapy can be really helpful for tension, especially through some of those larger muscles. And it can also be helpful for occipital neuralgia, jaw pain. We can work on referring for physical therapy, acupuncture, chiropractic, and if you have cervicogenic headaches, so again, coming from the cervical spine, we can look at your spine, figure out what's going on, order a spinal procedure if that's what's necessary. These are some nerve blocks that we can do here in the clinic. An occipital nerve block is going to be for that occipital nerve pain. So again, in the back of the head, the pictures always seem a little scary to people that we're sticking a needle right into the brain. Not the case at all. These injections, people actually tolerate them very well. But we can do these with and without steroid. The sphenopalatine ganglion block. So this actually is not an injection. I use a cotton-tipped applicator, so there's no needle involved. And the sphenopalatine ganglion, a ganglion is essentially a bundle of nerves, and it sits back by your nasal passages, and it has a connection to the trigeminal nerve pathway, which is one of the pathways that is related to migraine headaches. And so what we do is that cotton-tipped applicator has lidocaine on it, or a numbing medicine, and it's put back by the ganglia to essentially numb it. So the procedure, you lie back, we insert the cotton-tipped applicator, you close your eyes and you relax for a little bit, and then we take it out. So again, no needles. It's definitely a relatively comfortable procedure, and it can be very helpful. Trigger point injections. So those are going to be injections for tension headaches, especially if there's a lot of tight muscles, or what we call muscle knots, that are referring pain into the head. So very similar to these pictures, you can see the X's here is the trigger point in the trapezius, and the red is where that referred pain, or where they're feeling pain. Temporomandibular joint, so the TMJ, can do injections into the joint itself. We can also do masseter Botox, so trying to relax that jaw muscle. And then Botox for chronic migraine is a very valuable procedure too. Spinal procedures, again, if it were to come to that, if there's something going on in the spine, there's epidural injections, different procedures that we can actually burn the nerves at the small joints that I was discussing earlier that may be damaged from whiplash injury or may have arthritis. And then surgeries would be, last case scenario if conservative care really wasn't working. And so these spinal procedures are things that you and I would go through together, the causes of your headache and potentially what procedures we could do. And then we would order out all of the spinal procedures are done under an x-ray. So that is called fluoroscopy. And they're done by physicians, usually in a ASC or an acute surgical center setting. Cold laser therapy. There's no needles with this, there's no discomfort. So it's basically a natural re-stimulation of damaged cells. So occipital neuralgia, jaw pain, trigeminal neuralgia, trigger points, arthritis, muscle tears, muscle sprains, all of that, cold laser therapy can help. Sessions take, not even 5 minutes. And it's a very good procedure. Again, this can be added to other options. It can be the only option. And that's where we kind of sit down and look at what you've tried and what our other thoughts are. At Moderni Spine, one of my favorite things about my clinic is the migraine oasis. So this room was made to give people an outlet with acute headaches instead of having to go to the emergency room or to urgent care. So you get this room all to yourself for 90 minutes. We can do medications, we can do any of the procedures I mentioned while you're using this room. There's pillows, there's blankets. We can do aromatherapy, and then that TENS unit treatment I was discussing is also available. We also have an ice cap that will go over your head. It helps amazingly with migraines, also helps with tension headaches, making sure you have enough water. We can also do IV treatment too. So the Migraine Oasis is something that can be booked online, and there's noise canceling headphones or there's earplugs. It's dark, it's quiet, and it beats having to go to the emergency room, wait in the waiting room, and fluorescent lighting. But here are reasons that you should go to the emergency room. So if your headache's accompanied with any type of fever, stiff neck, if you're getting confusion, slurring your speech, significant numbness or weakness on one side of your body, if your normal headache medications are not helping. So this is one that sometimes our headache medications don't help, but it's more so that if your headache that you're having now is much more different than your normal headache, and so your medications that you take for your migraines might not help because it's something completely different, or that thunderclap headache that we talked about, quick onset, very severe headache, worst headache of your life. These are reasons you should go to the ER. So thank you so much for listening. I hope this helped. If you have any questions, feel free to send me an email. If you want to get an appointment and go over what your options could be, there's the online link to book. Otherwise, you can call the office line and leave a voicemail. The office line also accepts text messages too, so you can do that. But please reach out to me, and please share this with anyone you know that is suffering from any type of headache or migraines, and hopefully we can all come together and get some answers. So I really appreciate your time. Bye.